So the most common question that people ask us when they come to us for consultation or therapy is that how many sessions will I need? And the standard answer that I have for them is it entirely depends upon how deep-rooted and how widespread are the roots of your problem. However, to be more specific, let me share a couple of parameters that we look at our client from in order to decide whether will they need long-term therapy or will they be okay in a couple of sessions. The first is, of course, age. That the younger the clients we have, then obviously the baggage is much less, the number of pain files they've accumulated is much less. So obviously the clearing up and the rewiring that we need to do is much less. And once they get older, the neural pathways gets more hardwired, their belief systems become more rigid, and hence if the client gets much older, say a 40s, 50s, 60s, then of course our work gets more difficult and probably it goes on for a much longer period of time versus if we are working with, say, a 15, 16 or 20-year-old. So age is one factor. The second factor is the client's scores that we take. So we ask the clients to fill up certain standardized forms that are globally accepted by the psychology community to measure their areas or their levels of anxiety, depression, insomnia, and well-being. And if any of these factors are very high, so if the client has severe anxiety, severe depression, say insomnia, and the well-being score is very poor, then clearly it is an alarm bell for us and we know that this client may need a lot of work. Usually, when the anxiety depression scores are very severe, we also notice that the client would come with a high adverse childhood experiences score. Research says that if your ACE score, which is adverse childhood experiences score, is more than 4, then that means that there is a high chance that you would have severe cases of anxiety, depression, suicidal thoughts, insomnia, obesity, and other issues. So when a client comes to us whose ACE scores are above 4, then obviously we pre-warn them that they might require much more work than a client who comes with a much lower ACE score. Another factor that also determines whether the therapy is going to be difficult or easy for us to work with is the history of psychiatric medications. So when clients come to us who have already taken psychiatric medications for a number of years, then also oftentimes our job becomes very difficult because the psychiatric medications would normally numb out certain parts of their brain that are capable of processing certain emotions or relearning certain things. And hence with such patients also we require much long-term therapy. Another also important factor is the client's own ability or the own urgency to work on himself or herself. So if the client has clearly come because he is being pressurized by family members, or if he has come with a lot of preconceived notions about therapy, about himself. So in short, if the client is more rigid, has very strong coping structures, then also oftentimes our job becomes very difficult to first make them unlearn a few things and then relearn. There are times, I must admit, when our clients also surprise us. So even if all the parameters indicate that they may need long-term work, there have been cases whereby the client's sheer will and urgency to come out of the situation, coupled by our techniques, can oftentimes bring them in a much better space in a shorter period of time. And we always hope that that should be the case. So these are the 2 or 3 factors that determine how long the therapy will last or how many sessions will it need. So I hope this clears up this doubt and this question that a lot of you may be having on how much long therapy would be required for you.